Title of my study is The Comparison of Digital Microscopy with Conventional Microscopy in the Teaching of Oral Pathology, a questionnaire based study, and my abstract title is 00026. The purpose of this study was to assess the undergraduate dental students' perception regarding the application of digital microscopy as opposed to conventional microscopy when studying the dental histology and ground section slides among first year BDS students. The dental histology subject of Bachelor of Dental Surgery curriculum makes it mandatory for the students to learn the identification of different histological features for their practical training. Conventional microscopes are used to view the various histological aspects of hard tissue or soft tissue during practical training. Only a single student can visualize the microscopic slide at a time in conventional microscopy, which makes it difficult for them to ask their doubts or discuss the structures. The magnification of the structures for better clarity and detailed understanding also becomes difficult. Apart from the difficulty faced by the students, it is also cumbersome for the laboratory to maintain adequate slide collection as well as to ensure that the slides do not fade off. In the digital microscopic technique, an image is captured and stored in the electronic data file. The captured digital images allow modification of the image quality, and they can be easily evaluated, duplicated and manipulated to obtain better images that can be stored, thus assisting in retrieval and sharing. Consequently, this study was conducted to elucidate the perceptual response of undergraduate students when examining the histological slides using conventional microscopy and digital counterparts, with the aim of analyzing their input through the administration of a structured questionnaire. This educational based research was carried out in the Department of Oral Pathology and Microbiology after approval from the Institutional Ethical Committee. 99 students of first year Bachelor of Dental Surgery studying in our institute were included in this study. The purpose and methodology of the study was explained to all the students, and written informed consent was taken from all of them. Following an in-depth discussion of the histological slides, students were instructed to observe the identical slides with a specific focus on the same microscopic field using both conventional microscope and digital microscope. Both ground section slides and dental histology slides were included in the study. Following this observation, they were asked with the responding to a structured questionnaire. Validated questionnaire consisting of 8 questions comparing the overall level of understanding, clarity of the image, ease of interaction and more effective teaching technique between conventional microscopy and digital microscopy. The results obtained were sent for statistical analysis. In the picture you can see the students interacting during the digital microscopy and the conventional microscopy. In the results were statistically analyzed using SPSS 17.0 version 8. The frequency and percentage of each question for the ground section slides and the histology slides were calculated separately. 93.9% of the students preferred digital microscopy for ground section slides, and 73.7% of the students preferred digital microscopy for histology slides when assessing the better clarity of the image. 80.8% of the students found digital microscopic learning more interesting in ground section slides, and 66.7% of the students preferred digital learning more interesting for histology slides learning with a frequency of 66. Most of the students found that the digital microscopy facilitates more effective interaction when studying the ground section slides and histology slides with frequency of 83 and 82 respectively. More than half of the students recommend that usage of digital microscopy for teaching and learning practices for ground section slides as well as the histology slides. From an examination perspective, 69.7% and 58.6% of the students exhibited a preference for digital microscopy when examining the ground section slides and histology slides respectively. All the students agreed that circulation of the fixed focus digital image through smartphones and emails for extended learning processes of ground sections and histological slides is preferable. When comparing the level of clarity of understanding and effectiveness of communication and discussions, 90.9% of the students preferred digital microscopy over conventional microscopy in case of ground section slides and 83.8% for histology slides, and you can see the result in the table. Coming to discussion, traditionally conventional microscopy has played a crucial role in not only diagnosing oral pathologies but also in facilitating teaching and understanding both normal oral tissues and oral pathological conditions. In this study, the effectiveness of digital microscopy over conventional microscopy when studying the ground section and histology slides was evaluated with the help of a questionnaire. The students exhibited a preference for the digital microscopy technique due to significantly enhanced clarity coupled with the added benefit of zoom capabilities for more precise structural examination. Digital microscopy was also perceived as significantly more conducive to facilitating interaction among students and teachers for the purpose of resolving doubts or pinpointing challenging structural locations. The statistical analysis in this study unequivocally indicated that students consistently favored the utilization of digital microscopy as their preferred method for educational purpose in all aspects. In conclusion, we would like to say that the digital microscopy offers substantial advantages in comparison to conventional microscopy, and it is advisable to promote its adoption as a standard practice within educational institutions. Given the overwhelming preference of students for digital microscopy over the traditional approach in this study, we recommend that serious consideration should be given to its integration as a fundamental component of an oral pathology laboratory in the future. These are our references. Thank you.